Hello and welcome to the Kinesiology Files. I'm Katie and this is Katrina. Today we are going to talk about a serious disease that affects many Americans, peripheral artery disease, or PAD. This disease affects approximately 12 to 20% of Americans around 65 years and older.
Peripheral artery disease, PAD, is a disease in which plaque can build up in the arteries that carry blood to the limbs, brain, and organs. Plaque is composed of fat, cholesterol, calcium, fibrous tissue, and other substances in the blood. However, when plaque builds up in the body's arteries, the condition is called arteriosclerosis. Over time, plaque can harden and narrow the artery's pathway. When plaque becomes brittle or inflamed, it may rupture, causing a blood clot to appear. This limits the oxygen-rich blood to your organs and other parts of your body and could cause severe pain and infection. PAD is most common in the leg arteries. However, it may appear in the arms, kidneys, and stomach.
The most common symptoms of PAD include cramping, pain, tiredness in the leg and hip muscles when walking or climbing stairs. Now, this pain generally goes away when you rest, but it will return when you begin to walk again. Now, facts about peripheral artery disease include that many people mistake the symptoms of PAD for something else. This disease is often undiagnosed in physicians and doctors, and people with peripheral artery disease have a higher chance of developing coronary artery disease, heart attack, and stroke. If left untreated, peripheral artery disease can lead to gangrene and amputation. Now, you are more at risk for developing peripheral artery disease if you smoke, have high blood pressure, have diabetes, have high cholesterol levels, and are physically inactive. Your risk increases as you age as well.
So what are some signs of PAD? Well, research shows that weak or absent pulses in the legs or feet may be an indication of PAD. Additionally, sores or wounds on the toes, feet, or legs that heal slowly, poorly, or not at all, a pale or bluish color to the skin, a lower temperature in one leg compared to the other, and finally, poor nail growth on the toes and decreased hair growth on the legs. The thought of PAD may be frightening, but this doesn't have to happen to you. Research shows that there are always ways to reduce your chances of getting PAD. So what are some of the steps that you can take to prevent PAD? Well, 1, be physically active. 2, eat healthy meals, such as fruits, vegetables, whole grains, and lean meats. 3, refrain from smoking. 4, stay hydrated. And finally, 5, try to maintain a healthy body weight.
The main objectives of treating peripheral artery disease are to reduce the risk of stroke and to reduce the symptoms of claudication, which is the cramping pain due to decreased blood flow, which generally occurs in the lower extremities. Your doctor will first recommend you to have a more active lifestyle and to eat healthier meals. Now, surgical procedures may need to be considered depending upon the severity of the disease. Here's a short clip of Dr. William Julian discussing surgical treatment options.
Peripheral arterial disease, also known as PAD. That is the buildup of cholesterol plaque along the walls of the artery supplying the lower extremities. This causes different symptoms. The first symptoms we see in patients are that they have what's called claudication, which is pain, tightness, or tiring of muscles after you walk a certain distance. And depending on where the vessel's narrowed, it can affect different muscles. So sometimes people will have pain in their buttocks, sometimes in their thigh, sometimes in their calf muscle when they walk a block or two. In more severe cases, if the blood flow is more compromised, people can start having pain and numbness and tingling in their feet at rest when they're not even moving. And in more advanced cases, you might even have some tissue loss, like an ulcer in one of your toes or even gangrene. The treatment of this PAD is to restore blood flow to the lower extremity. And There's both minimally invasive techniques, which I perform, as well as open surgical techniques, which are done by a vascular surgeon. The minimally invasive techniques, using catheters, which are little tubes, we navigate through the bloodstream under X-ray guidance and inject dye so that we can see under the X-ray guidance. And then we go and open up the artery with different kinds of miniaturized tools. One of them is called an angioplasty balloon. It's a balloon that goes and stretches open the artery, and it pushes the plaque to the side so that you can have normal blood flow through the area. Now, sometimes that's not effective, and we'll leave in what's called a stent, which is a tubular metal mesh-like device, and that actually holds the artery open and pushes the plaque to the side.
Wow.
Wow.
Thank you so much, Dr. Julian, for sharing your knowledge on this critical subject. Well, now we have a special report for you from our own Emmanuel Mendoza. He's out in the field with two sisters. You're going to be able to see the difference in lifestyles between someone with PAD and someone without PAD. Over to you, Mendoza.
Thanks, Katrina. Right now I have two twins with me, and we're going to discuss some of their lifestyle differences. Although they are identical, they don't have the same lifestyle. We're going to discuss specifically PAD and see what some of their nutritional values are. So, how would you describe your nutritional intake?
For me, I eat healthy. I like to eat green leafy vegetables, broccoli, spinach, kale. I love to eat fish. Fish is good in omega-3 fatty acids, which is essential. I also like to eat whole grains, low-fat dairy products, and I just love fruits. That's the way of life, and I love drinking water. I only drink water. I don't drink sugar, alcohol, caffeine. I don't consume any of that. I do consume Gatorade. It has essential electrolytes for exercise. It's just great. That's my diet.
How about yourself?
I'm the exact opposite. I don't really eat healthy, I guess you can say. I like McDonald's, Pizza Hut, and I love snacks. I love pudding, cakes, cookies. All that stuff really is not as bad as people talk about it, but I don't pay attention to my sugar intake. I love soda, Sprite, Coca-Cola. That's mainly what I eat, to be honest. Go.
So what about physical activity? What do you two do?
So for me, a wise man named Dr. Bernard told me that I must exercise at 60 to 80% of my VO2 max for a duration of 20 to 30 minutes a day and 3 to 4 days a week. And as you can see, the results are proving itself to be true. Well, I fell asleep during that class, so I don't know much about VO2 max, but to be honest, I don't exercise because I start to get cramps in my legs. Because I have PAD, it starts to get sore, I feel a lot of discomfort, so I just watch TV. That's my form of exercise, to be honest.
Okay, well, you need to start making healthier lifestyle choices. Unlike your sister, you've made some very poor choices. You need to follow her nutritional example and go to the gym with her. Let's go work out together.
Let's do it. Let's get started. Such a long journey, but it's been a great one. I'm proud to say that I no longer have peripheral artery disease. I no more have it. I have eliminated all of the pain, all the discomfort that's going on in my legs with the help of my sister. And something as simple as using the treadmill, exercising really eliminated this disease. So for anyone out there who's dealing with this, let my story be an example for you. You can really get rid of this disease just by exercising.
What a fascinating story.
Isn't it? It's just amazing that eating right and living a healthy lifestyle can really prevent your chances of getting PAD. Yes. Yeah. Well, anyway, that concludes our segment for today, but be sure to join us next week. We have a special guest, Dr. Bernard, coming in to talk more about exercise.
Wow, so that concludes our episode. Thank you for watching, and remember, a healthy lifestyle is just steps away. Thank you.